I started this as a skeptic. I'm a former critical care physician. I trained at Johns Hopkins University. The near-death experience is the gateway to understanding the miracles that are going on around us. One boy, he was underwater for 45 minutes, and yet he survived through a miracle. Another little girl that I resuscitated. Very few patients survive such a profound coma, and yet she did. It was a miracle. An angel got me in trouble at my hospital. This is a true story. It illustrates that angels are around us and we're not even recognizing. There's so many examples. I was contacted by these parents. They were at the University of Washington, and the baby, the infant, in utero had been diagnosed as having no brain. I said, there must be some mistake. I'm looking at this chart, but your infant is obviously very healthy. Miracles are around us all the time. This was a teenager who had died. It's been over 1,000 days since our son died. And the nurse looks at me and she says, so who's that medical student with you today? I said, I don't have a medical student today. In spite of my training at Johns Hopkins, I knew that there's more to this reality. The voice said to him, no, go see her tonight. Tomorrow is too late. He puts his hands on her abdomen, and her abdomen started to glow with a white light. It is part of us that is part and surrounds us, that facilitates these miracles that we see in the near-death experience. Start to pay attention, because these miracles are happening in your life, and you're not recognizing it.
The A.J. Parr Spiritual Journalist Podcast.
We're here with Dr. Melvin Morse. He is a pioneer researcher in children's NDEs. Hello, Melvin. How are you?
I'm so glad, AJ. It's an honor to be here. I want to talk to you today about miracles. One thing I've learned from studying near-death experience is that understanding the near-death experience is the gateway to understanding the miracles that are going on around us all the time. I started this as a skeptic. I'm a former critical care physician. I trained at Johns Hopkins University. And when we did our original studies of near-death experiences in children, we actually thought that they were caused by either a lack of oxygen to the brain or the many drugs that we give when we're resuscitating clinically dead patients, bringing them back to life. But to our great surprise, published in the American Medical Association's pediatric journal. So that's not the Guru Monthly, HA. That we showed that near-death experiences are real experiences that will happen to us all when we die. And I learned from this that miracles are around us all the time. Crystal Merslock is the first patient. And this was back when I was only interested in putting lines in patients and bringing them back. And Crystal Merslock was a young girl who nearly drowned in a community swimming pool. She was underwater for 20 minutes, and yet she survived after being clinically dead. When she presented to the emergency room and we flew in from Airlift Northwest, she was as close to death as any patient had ever seen. I called her parents in to pray at her bedside because I told her demise was ended. She had what we call a Glasgow coma score of 1. Very few patients survive such a profound coma, and yet she did. It was a miracle. And this miracle, facilitated by her encounter with a place that she thought was heaven, a person she thought was God, and a stranger who was there named Elizabeth, who told her to crawl to heaven and that she would help her and bring her back to her family. Well, at the time, AJ, I was like, Oh, man. This was way, you know, and Crystal told me this story a couple of weeks after she was recovered, and I happened to see her for follow-up. She saw the look on my face, and she says, "You'll see, Dr. Morse, heaven is fun." But my training at Hopkins, although it did not prepare me for any kind of spiritual aspects to death and dying, and I was always trained that the brain creates consciousness. Now, of course, we know that consciousness works through the brain. The reason I'm saying this about my training at Hopkins was that I was taught to go where the evidence leads you. So I asked these parents, I said, "What did you teach her about death and dying?" They said to me, "Well, we sure didn't tell her that you go to heaven on a brick-lined tunnel. There's no Saint Elizabeth in our religion. There's no Elizabeth that had died, or she doesn't have a grandmother named Elizabeth. We told her that the soul is the hand and that the body is a glove, and that when you die, the glove comes off the hand." So right away, that taught me or told me that something unusual was going on here. Because if this was just some sort of product of her religious imagination, it should have matched what she had been taught. After Crystal Merzlock's experience, we then went on to study all survivors of cardiac arrest at Seattle Children's Hospital. All patients who survived clinical death, including one boy. He was underwater for 45 minutes. And yet, he survived through miracle. And his survival was facilitated by his encounter with what he called heaven. That somehow his going to heaven during this time that he was clinically dead led to his successful resuscitation. And again, I have the advantage in which I actually interviewed these patients myself. You hear these stories and you're like, you can hardly believe they're true. And, even though they might not match the patient's religious training, by this time, hasn't everyone heard of near-death experience? Oh, doesn't everybody want to be on Oprah? So maybe they're just making it up, that they've heard about other experiences. But when you hear it for the first time, you know they're miracles. Here's what he said to me. I said, "So what do you remember about the time you were in the intensive care unit?" We asked these bland, open-ended questions so we could hear and not, prime the pump, not give him a leading question. And he looked at me and, "Do you mean when I was in the huge noodle?" I said, "Noodle?" He said, "Yeah." He said, "When you were doing all that stuff to me, I was in this huge noodle." And then he goes, "What? No, it couldn't have been a noodle because noodles don't have rainbows in." So you know this was a real experience that he was struggling to understand and try to tell me. You hear it the first time, he says the noodle with the rainbow. After that, sure, he only said I was in the tunnel. But that first time, he said that he went down the noodle into the rainbow. He went to a place that was called Animal Heaven to him, met a bee that gave him food and was very nice. For these guys, he's not making this stuff up. You can't make that sort of thing up. Then he said he went to human heaven. He was given a choice to return. So it's that choice, that light, that loving light that comes to us at the end of life. It's that choice that can facilitate miracles. And when, he isn't the only one that gave me this authenticity that these children are trying to understand the experience, not invent it. Another little girl that I resuscitated had to put a needle into her heart to bring her back to life. And she says to me, I was out of my body. She's asking me, like, I was out of my body. I said, okay, so what, how did you get back in? And she goes, that's what I'm trying to figure out. These miracles are happening in your life, and you're not recognizing it. And I learned this with a patient named Taryn Headland. And Taryn Headland was born with a universally fatal disease called Wolman's disease. And that's a genetic disease of the liver, which is universally causes death, unfortunately. 3 to 4 months of age, she weighed 2 pounds less than when she was born. We did a number of extensive studies to see what was wrong with her. We sent away biopsies of her liver to Children's Hospital in Philadelphia, who were the experts at that time on Wolman's disease. And they sent us back the unfortunate news that Taryn had. It's one of the hardest things that I've ever done, AJ. I got this report back from Children's Hospital of Philadelphia on Christmas Eve. So, I was, what am I going to do? Am I going to ruin their Christmas, by bringing them in and giving them these results? But not my job to decide when or when they shouldn't get information about their child. And I thought to myself, what would I want? I would want to know. I wouldn't want someone to assume that, that my Christmas would be better off if I learned about Taryn, after the Christmas holidays. So I brought the Headlands and I told them the unfortunate news. And Mr. Headland's hands just ringing like this. He just couldn't stop with his hands. They were devastated. And they went home. I told them I'd see Taryn in a month. So they brought Taryn back a month later. Taryn had gained weight. She was healthier. Another month went by. Taryn started to develop the way a normal infant would and still gained weight. The mother and I, we wouldn't talk about it. She would come in month after month, actually, and Taryn is developing. So I'd see her and say, "Oh, it seems like she's doing well." But finally, when Taryn was about 9 months old, Mrs. Headland said to me, "What's going on here? You told us that Taryn, had Wolman's disease, and yet she's thriving." I said, "I can't explain this. I don't know what's going on. But you know that I've done near-death research on children, and I've seen many miracles happen. I've resuscitated a young boy, and after we resuscitated him, he opened his eyes and he looked at me and he said, 'That was weird. You guys just sucked me into my body.'" So I knew, in spite of my training at Johns Hopkins, I knew that there's more to this reality. And she took this information home to her family. And she told them, "Well, Dr. Morse thinks something spiritual happened." Well, I didn't actually say that, but, I sort of hinted at it, I guess. And so the word went out to the family, and they asked around. And sure enough, Taryn's uncle, who was the black sheep of the family, estranged from the family. I interviewed him, and he's given permission for me to give these details about his life. He's doesn't believe in God, substance abuse issues, didn't really get along with his sister at all. So he says that on Christmas Eve, he was lying in bed, and a voice said, "Go see Taryn Headland." He heard it as loud as us talking here. Like, hey, all right, he said, this must be a hallucination. And the voice said it again, "Go see Taryn Headland." All right, I'll see her tomorrow. I can't believe this has happened. The voice said to him, "No, go see her tonight. Tomorrow is too late." He was so embarrassed by all this that he didn't even tell his wife where he's going. He told her he's going out for a pack of cigarettes. He goes over to Taryn's house, and the family is just, grieving. They see him, but they don't really, process that he's there. He doesn't really say hi to anybody. Doesn't want to tell him he just heard a weird voice telling him to come over. He goes up to Taryn's bedroom. He goes and he looks at her, and he puts his hands on her abdomen, as he had been instructed to by the voice. And her abdomen started to glow with a white light. He then just left, and he never said another word about it. As he told me, he said, "I'm the last person that would facilitate a spiritual healing." That's the story of Taryn Headland. So, she thrived, developed normally. She's grown up now to be a healthy adult without any trace of Woolman's disease. Her DNA was somehow corrected by her uncle's intervention. But here's the thing I want to share with you and your listeners, AJ. When you hear this story, I then went to Dennis Christie, who was head of gastroenterology at Seattle Children's Hospital. And I said, "What do you make of the Taryn Headland story? How can you explain this?" He said, "I can't explain it, but this happens. It happens more commonly than you think." That's what Dennis Christie. And Dennis Christie was not a touchy-feely. He was like a kind of a gruff manner, not really touchy-feely with the patients. And yet that's what he told me. And I suddenly realized he's right. This sort of thing is big. But if I hadn't talked to those parents, and those parents hadn't taken the time to talk to the estranged brother-in-law, they would never have known this. They would have just got better, not even understood on a miraculous basis behind it. And he's telling me that this happens all the time. He said more frequently in his practice than once a year. None of those people were aware that these miracles are happening. We have to pay attention. We have to look carefully. And when I started doing that in my own life, AJ, more miracles presented themselves. I'm going to tell you a story now about how an angel got me in trouble at my hospital. This is a true story about how an angel, but it also illustrates that angels are around us all, and we're not even recognizing. I was the critical care or backup physician for the hospital, or Valley General Hospital in Seattle, Washington. And, I was, of course, at the University of Washington at that time as well. And I had a private practice. But I was sort of the go-to doctor whenever a critically ill infant came in. So this patient mother came in with what's called placenta previa, which is where the placenta is separating from the uterus. And this is a medical emergency for the infant. She was rushed to the hospital, rushed to the delivery room. It's called urgently. The reserves obstetricians delivered that baby in record time, less than 5 minutes. Did a cesarean section, pulled that baby out. But the baby wasn't breathing. So it was my job to put a tube into baby's lungs. Well, I've done this for 20 years, but that was one day where I was not on my game. Couldn't get the tube into her lungs. I tried 3 times. The baby's just getting bluer and bluer. The nurses were looking at me, why can't you do this? And I look around the room, and there's one of the medics that had brought, the mother in. And he was just casually leaning against the wall. And he very calmly says to me, "Doc, would you let me have a try?" The medic team was trained in intubating patients. So, I knew he had the training. And I looked at him and said, "Sure, give it a try." And he just calmly smiled and he said, "Don't worry about a thing. I've got this." And he intubated the baby and saved the infant's life. So how did I get in trouble? Well, protocol at our hospital is that the anesthesiologist is the person who's supposed to be my backup. If I can't intubate the baby, the chain of command is the anesthesiologist. He's caring for the mother. And he was angry because he said, "You let a medic do this? The medic doesn't have malpractice insurance. The medic isn't under the auspices of a hospital. You just sort of let some person that wandered in to the Dell room and intubate that patient. But that is not proper care." And he had the hospital call a morbidity and mortality meeting to discuss my care of the patient. Because he was mad. Because he was supposed to, be the hero. Well, I decided I would track down this medic because I wanted to hear more about it. Why was he in the delivery room anyway? And I said, I need to talk to those medics. And I talked to them. I said, "Who was the one who was in the delivery room with me?" They looked at me and they said, "What? What are you talking about?" I said, "Yeah, who was the medic? You brought in the mother. Who was the medic who then came into the Dell room?" "Dr. Morse, we're not permitted to do that. We have no, any reason to be at the hospital, or we're not permitted to intubate patients in the hospital. We were out there waiting in the medic rig, wanting to know what was happening, wanting to see if we'd be called. We couldn't find that. Since the medic wasn't around to come in and discuss why he did what he did, this caused such confusion. Everywhere, there was a full court press to figure out who this medic was. The nurses were interviewed. This medic was an angel. That conference was never held. But think about this. If that anesthesiologist hadn't been such a jerk, we would never have known that there was an angel in the delivery room. So it was my way because I looked a little deeper. But this may be happening all the time. We would have never known there was an angel in the delivery room if I hadn't looked deeper and started to ask around, why is he there? There's so many examples. I'm going to give you a couple more once I started to pay attention. I was a medical student and I trained under the great Vernon Montencastle. who's one of the greatest neurosurgeons, really in history. And he had a patient in which we removed half of the patient's brain to control intractable seizures. Of course, conventional neurology, since the brain supposedly at that time we thought creates consciousness, and the right half of the brain controls the left side of the body, the left side of the brain controls the right side of the body. Well, it was my job to do a physical exam on this patient and to find how much deficit. And guess what, AJ? He had a slight limp, and otherwise you could not tell that half his brain was removed. I told the Dr. Monk, I said, how can this be true? We're taught that the brain controls the body, controls consciousness. How could we remove half of the brain, and yet the patient still has a sense of humor, all his memories, everything? This is what we were taught in neurology class, Dr. Moncastle. Dr. Moncastle said to me, neurologists, what the F do they know? You know, God told me there's more to this life than we know. That miracles are happening all around us. And I had to have it, I guess, pounded into my consciousness through the many miracles I see after this. I was contacted by these parents who were angry about their care at the University of Washington. And I had a lot of patients who were angry at my practice simply because I was a straight shooter and I would review their medical records. When practice had happened, I'd tell them, you know something? That didn't go so well, but that isn't why your child. I had a bonoc. And so, I felt I was doing a service. I helped more patients and frankly, helped the medical system, prevented more cases, malpractice cases by being honest with patients. Now, these patients came to me with their newborn. I looked at the medical records, and AJ, they were at the University of Washington, and the baby, the infant, in utero had been diagnosed as having no brain. No brain. Anencephaly. You do not give a patient that kind of diagnosis unless you're certain. So the University of Washington, with all of their medical expertise, told these parents that their baby had no brain and unfortunately should be delivered urgently. These parents are in the horrible situation of having to deliver a baby that has already died. Well, so I looked at the parents. I said, there must be some mistake. I'm looking at this chart, but your infant is obviously very healthy. That they sent you down with the wrong chart. Those parents looked at me and they said, no, Dr. Moore, you believe those idiots at the University of Washington? They told us that our baby had no brain. How stupid was that? We know they were wrong. We didn't believe us for 1 minute. They weren't to deliver our baby when our baby was only 20 weeks old and wouldn't have lived. We knew they were wrong. So, MJ, how many cases like that happen? But they're not brought to anybody's attention. Because after all, it wasn't like I didn't call the University of Washington. I didn't tell them, by the way, you guys made, a horrible mistake. That there was no brain. And yet somehow, miraculously, the baby was born with a brain. So those doctors never got that feedback. So they themselves were unaware of a miracle that happened, yet in their own practice. I was also in private practice at this time, seeing dozens of ear infections every day. And these parents came to my office. They didn't bring their child. How can I help you today? It's been over 1,000 days since our son died, and we want you to explain to us what happens after death, because we heard you're the great Dr. Morse, and you've been on Oprah. By the way, publishing in the most prestigious medical journals, that near-death experiences are real, that's not as important as appearing on Oprah. So I said, I'm so sorry, for your loss, and I want to help you. They said, we've been to Raymond Moody's workshops, been to Brian Weiss's workshops. We've gone, from expert to expert, and still we cannot find any peace. And they said, here's our son. We want you to see him. And they pressed his picture into my hand. This was a teenager who had died. I was called to the hospital. There's a critically ill infant over there that you have to resuscitate. I put the picture into my pocket and I excused myself. I've got to go. I do want to talk to you more about this, but I've got to go to the hospital. I went over there, resuscitated the infant, or, our team. It's not me. We have a team that we all work together. And it was a successful outcome. I was out at the nurse's station writing up my note. Back in those days, we actually wrote notes. And the nurse looks at me and she says, so who's that medical student with you today? I said, I don't have a medical student today. I was, on the faculty at the University of Washington at the time. So medical students usually worked with me, but we didn't have one that day. She said, no. When you came over from your office, there was a medical student with you. And sorry, I don't know what to say. She looked in my pocket and pulled out the picture and she said, that's him. That's the medical student I saw. That is who you saw with me. I suddenly realized that their son had been trapped all these years. Their grief was so intense that he just couldn't break through. I went back to the office and those parents had waited for me, an hour, which my patients often did. And I showed them the picture and I told them what the nurse had told me. I said, your son is with us right now. And I know because one of the nurses at the hospital told me so. And she's one of our top obstetrical nurses. She's not going to say something like that unless it's true. I said, I want you to go back home. He lived in New York, flew all the way to Seattle. I want you to go back home. I want you to write in a journal every night a sincere question to the universe, such as, where is my son? How can I contact my son? And then write down the first answer that comes to you in the morning. And I want you to join a support group called Compassionate Friends, so you can start to handle your grief and start to process so that you're in a better position. They did that. And that mother called me a week later. She said, within a week, my son woke me up the night, was at the foot of my bed, and said, Mom, stop crying. I'm okay. I'm okay. I love you, Mom. I need you to stop crying and know that I'm okay. And that mother told me that night was the first time that she had slept in many years, and she slept every night after that. But again, if that nurse hadn't said to me, "Who's that medical student today?" we would never have known that this had happened. I paid attention when that nurse, and I believed her. And that's an important message that all of us need to understand. We often push down our deepest intuitions. When we know that something spiritual has happened to us, our first instinct is to say, "No, that isn't true. That isn't real." And yet, when we speak from fear, when we speak from anxiety, anger, grief, we tend to believe that. When we cry out in anger, "Why has God done this to me?" It can't be possible that this is anything but a cruel joke from the universe. Those types of feelings we believe. And I really think it was my work with near death that led me to then believe that nurse. When she said, "Hey, who's that medical student today?" I took seriously. I didn't just blow her off. Like, "What the heck are you talking about? That can't be true." I had the courage to tell those parents. Instead of just saying, "I don't want to tell them some crazy thing that nurse told me." I had the courage to believe that what I experienced was real. And for your listeners, in their life, they have deep feelings that they've ignored or trivialized because they don't want to be thought of as crazy. We studied 26 children at Seattle Children's Hospital. We asked them what it was like. And none of them had told their parents or their psychiatrists or their therapists. And I asked one little girl, "Why not?" She drew me this detailed picture of her own resuscitator was accurate in the time I knew she was clinically dead. And she looked at me and she said, "I didn't know you were supposed to be able to talk to God." So even at her young age, she knew that we can believe in God, but if we actually have an experience with God, then we must be crazy. That's what near-death experiences have taught me. It's the gateway to understanding that we are all connected to the divine. And sure, of course, people have mental illness, and that leads them to, making stuff up. But normal, healthy people also have perceptions of spirituality, and we can't dismiss them just because a small percentage of people, in fact, have mental illness, and their mental illness presents in those ways. There is something that is part of the consciousness that is part of us, that is part and surrounds us, that facilitates these miracles that we see in the near-death experience. But start to pay attention. These miracles are happening in your life, and you're not recognizing it. So pay attention.
This has been the A.J. Parr Spiritual Journalist Podcast. Please like, share, and subscribe.